My name is Astrid Jimenez, and I am the Executive Director of Nueva Vida. Nueva Vida is a support health network for Latinas with cancer. It began 22 years ago when three very dynamic Latinas experienced breast cancer and began questioning what would happen and what was the experience of Latinas who did not have health education, health insurance, or the financial means to go through the cancer experience. And out of this generous heart, Nueva Vida was founded. Last year, we were challenged. As a direct service provider, one of our challenges was how to provide for our cancer continuum services in a virtual environment. Our highly personalized services are outreach education, patient navigation, and mental health support groups. The second challenge was how could we alleviate the many needs that arose out of the pandemic, needs within an already vulnerable population. Thirdly, how could we raise funds in an uncertain and never experienced environment when now more than ever we needed unrestricted funds to help the community and the organization? How much more could we do for the community? And how would our survivors fare the pandemic? Quickly, we had to put aside our existential concerns and act like the mother hen that droops her wings, covering the chicks to protect them. And our way of doing business was modified.
During the pandemic, we experienced different challenges. One of them it is and how to meet with our clients through our support groups. And we had to train every single lady in how to use technology and how to use Zoom application. And after several weeks of training, we can provide them all the mental health support through internet, through Zoom application, and that give us the opportunity to provide mental health support twice per week to our cancer patients. Through our patient navigator, we experience a lot of challenges, but we overcome them, providing accompaniment through telehealth and also provide them support in all the calls with the doctor's appointments and with all the screening mammograms and helping them to fill a lot of applications for having access to the healthcare uh, to the healthcare. In our outreach and education, we can provide workshops through Facebook to different groups in our community, but also we have the big opportunity to educate through our Facebook Live workshops, and more than 5,000 people come to see our videos educating our population regarding COVID and regarding cancer. And thank you for all your support.
Nueva Vida provides direct cancer services to the Latino community. Our approach is personalized and it is culturally appropriate to the community we serve. During pandemic, we faced new challenges. One of these challenges was the fact that we needed to shift our services and communication with survivors to a virtual environment. We needed new equipment and new platforms. Another challenge, and the most important one, was the fact that our survivors were and are suffering food insecurity. They don't have enough money to pay for medicines and other basic needs. Thanks to a Spring to Action, we were able to buy food, personal protective equipment, and gift cards that we distributed among our survivors, and they were able to pay for food and other basic needs. Funds for Spring to Action are key to help the community, the Latino community. We need your help to continue supporting women, cancer survivors, and the Latino community, a community that has been disproportionately affected by this pandemic.
You need to know that our Latino community needs Nueva Vida now more than ever, and Nueva Vida really needs you. Our community is more vulnerable after the pandemic and will need a greater investment of time, resources, and energy to bounce back to the previous level. The pandemic did not stop cancer. The pandemic exacerbated the cancer. So many women could not get screened on time or get adequate treatment because providers feared virus contagion. Your financial support of Nueva Vida is translated into more screening and diagnostic mammograms, more support groups, more educational activities, more collaboration with university researchers, and more help to the community. We're always looking for skilled volunteers to fill some of the gaps that we have because of lack of funding. And once we're able to have or participate in in-person outreach and educational activities, we will welcome your presence and your help. Thank you so much for supporting Nueva Vida.
My name is Laura Logie, and I'm the Director of Research. Nueva Vida, which literally means new life, has as its core strategy the viewpoint that no one is disadvantaged from achieving their health potential because of their race, ethnicity, social position, or any other defined dimensions of difference. Inequitable health care for the Latina immigrants has resulted in unequal treatment, implicit bias, structural inequity, and the need for increased cultural competence in the healthcare system. Nueva Vida clients are currently in crisis with little to no financial resources during this COVID-19 pandemic. Most are extremely low-wage workers who are ineligible for safety net assets, such as Medicaid and ACA, and are in critical need of the basic necessities in life. These necessities include prescription medication, doctor's fees, and essentials such as food for themselves and families. Our organizational goals remain to focus on the bonds of trust between our clients, which are paramount to providing the services we have for the last 2 decades. This support and trust supports our 2021 goals to reduce breast cancer mortality by addressing these disparities, increasing access to quality and timely care, and improving health outcomes through our programs. Moving forward in 2021, Nueva Vida will continue working toward our overarching goals by creating equal healthcare access opportunities to help change the narrative in addressing these inequitable health factors across the social determinants of health. Now more than ever, we rely on the generous support provided through Spring to Action and are thrilled to participate once again.
The Nueva Vida Board of Directors Spring to Action because it brings together our communities to help others.
I spring to action because I am Nueva Vida cancer survivor. And during the pandemic, they helped me with groceries, face masks, and gift card. Thank you for Nueva Vida. Thank you for everything.
I spring to action because as Nueva Vida outreach and screening cancer navigator, I see how much we impact our community and how much they trust us. At Nueva Vida, we save lives.
Yo participo en Spring to Action porque soy sobreviviente del grupo de Nueva Vida. Fui diagnosticada 5 veces de cáncer diferentes y Nueva Vida siempre me ayudó. Nueva Vida salvó mi vida.
I spring to action because I am a Nueva Vida's cancer survivor and as their patient navigator for the last 14 years, I see the impact it makes in the Latino cancer community.
I spring to action because I have a metastatic breast cancer and Nueva Vida helped me understand the diagnosis and is helping me with my depression. Thank you, Nueva Vida.
I spring to action because Nueva Vida saves lives, and I know that's because they saved my life. So today I ask you to spring to action to help Nueva Vida to raise funds so that way they can continue to save lives. Thank you.